This is an area of concern, especially for many Asians who have very large cheeks or cheeks that are flaring out. Many don't like it. It exceeds really the line of their face and adds to the sort of imbalance and asymmetry of the face. By reducing the bone, in medical terms called zygoma or cheekbone, I can achieve a really narrower face. And this is done by actually making cuts on the cheekbone, much like a facial fracture or somebody who broke their face. By making precise cuts and allowing the bone to sort of sink in, I can narrow the face. Surgeons use plates and screws. I haven't used it. I've been doing this procedure for about over 20 years, and I found it to be very effective even without the use of plates and screws. I hold it in, and the bone pretty much stays in place within a week, and within 3 weeks it's completely healed, so you get the desired effect. And the incision to do this surgery is mostly from inside the mouth. So again, patients don't really see any external scars with cheek reduction.